What's going on, guys? It's Nate Humphrey here, and today we'll be talking about diabetes or diabetes mellitus. It refers to a group of diseases that affects how the body uses the blood sugar slash glucose. Glucose is an important source of energy for the cells that make up the muscles and the tissues. It's also the brain's main source of its fuel. The main cause of diabetes varies by type, but no matter what type of diabetes you may have, it can lead to excess sugar in your blood. Too much sugar in your blood can lead to serious health problems. Chronic diabetes conditions, including type 1 and type 2 diabetes, potentially reversible diabetes conditions, including pre-diabetes and I'll put that on the screen. I don't know if I said that right. And pre-diabetes happens when blood sugar levels are higher than normal, but the blood sugar levels aren't high enough to be called diabetes. And pre-diabetes can lead to diabetes unless steps are taken to prevent it. Gestational diabetes happens during pregnancy, but it may go away after the baby is born. Some symptoms you may have. Diabetes symptoms depend on how high your blood sugar is. Some people, especially if they have pre-diabetes or gestational diabetes or type 2, may not have symptoms. In type 1 diabetes, symptoms tend to come on quickly and more severely. Some of the symptoms of type 1 diabetes and type 2 are feeling more thirsty than usual, urinating often, losing weight without trying, presence of ketones in the urine. Ketones are a byproduct of the breakdown of muscles and fats that happen when there's not enough available insulin. Feeling tired and weak, feeling irritable or having other mood changes, having blurred vision, having slow healing sores, and getting a lot of infections such as gums, skin, and vaginal infections. Type 1 diabetes can start at any age, but it often starts during childhood or in the teen years. Type 2 diabetes, the most common type, it can develop at any age. Type 2 diabetes is more common in people that are older than 40. But type 2 diabetes in kids is increasing. When to see your doctor or a doctor in general. If you think you or your child may have diabetes, if you notice any possible diabetes symptoms, contact your healthcare provider. The earlier the condition is diagnosed, the sooner treatment can begin. If you've already been diagnosed with diabetes after you receive your diagnosis, you'll need close medical follow-ups until your blood sugar is at a stable level. Some of the causes that may cause diabetes. It's important to understand how the body normally uses glucose, how insulin works. Insulin is a hormone that comes from a gland behind and below the stomach, the pancreas. The pancreas releases insulin into the bloodstream. The insulin circulates, letting sugars enter the cells. Insulin lowers the amount of sugar in the bloodstream. As the blood sugar levels drop, so does the secretion of insulin from the pancreas. The role of glucose. Glucose is a source of energy for the cells that make up muscle and other tissues. Glucose comes from two major sources, which is food and the liver. Sugar is absorbed into your bloodstream when it enters cells with the help of insulin. The liver stores and makes glucose. When glucose levels are low, such as when you haven't eaten in a while, the liver breaks down stored glycogen into glucose. This keeps your glucose levels into a topical range. The exact cause of most types of diabetes is unknown. In all cases, sugar builds up in the bloodstream. This is because the pancreas doesn't produce enough insulin. Both types 1 and 2 diabetes may be caused by a combination of genetics and environmental factors. It is unclear what those factors may be at this point. Some risk factors. Risk factors for diabetes depends on what type you may have. Family history may play a part in all types. Environmental factors and geography can add to the risk of type 1 diabetes. Sometimes family members of people with type 1 diabetes are tested for the presence of diabetes immune system cell. Autoantibodies. If you have these autoantibodies, you have an increased risk of developing type 1 diabetes. But not everyone who has these autoantibodies develop diabetes. Race or ethnicity also may raise your risk of developing type 2 diabetes. Although it's unclear why, certain people, including blacks, Hispanics, American Indians, and Asian and American people, are all at higher risk. Prediabetes, type 2 diabetes, and gestational diabetes are more common in people who are overweight and obese. What are some complications for long-term complications of diabetes developing gradually? The longer you have diabetes and the less control your blood sugar is, the higher the risk of complications. Eventually, diabetes complications may be disabling or even life-threatening. In fact, prediabetes can lead to type 2 diabetes. Possible complications include heart and blood vessel or cardiovascular disease, nerve damage from diabetes, kidney damage from diabetes, eye damage, foot damage, skin and mouth conditions. Diabetes may lead you more prone to skin problems, including bacterial and fungal infections. Hearing impairment, Alzheimer's disease. You have an increased risk of developing Alzheimer's disease and dementia. Depression related to diabetes. What are the complications of gestational diabetes? For women who are gestational diabetes, deliver healthy babies. However, untreated or uncontrolled blood sugar levels can cause problems for you and your baby. Complications in your baby may include excess growth, low blood sugar, type 2 diabetes later in life, and or death. Complications in the mother, preeclampsia. I'll put that on the screen. Symptoms of this condition includes high blood pressure, too much protein in the urine, and swelling in the legs and feet. Gestational diabetes in one pregnancy, you're more likely to have it again in the next pregnancy. Some preventions. Type 1 diabetes can't be prevented, but the healthy lifestyle choices that help treat prediabetes, type 1 diabetes, and all other diabetes can also help prevent them. Eating healthy food, getting more physical activity, lose excess pounds, and sometimes drugs are an option. Oral diabetes drugs such as metformin, glimepiride, Fortamet, others may lower the risk of type 2 diabetes, but healthy lifestyle choices are important. If you have pre-diabetes, have your blood sugar checked at least once a year to make sure you have not developed type 2. Alright guys, I hope you guys enjoyed. If you did, make sure you give it a thumbs up. Hit that subscribe button, turn your post notifications on so you don't miss out. I love you guys. I will see you in the next video. Stay safe.